Okay, so you're here, right? You want to get smart, but you want to do it fast. And you don't want to get bogged down in every little detail. You want to efficiently become well-informed. Well, that's what this deep dive is all about, giving you that extra edge. And today, we're going to tackle a huge one, a really important one, Social Security.
Yeah.
You've shared a really thorough chapter with me. We're going to really try to boil it down and pull out like the most important nuggets of information that people need about this system.
Absolutely. And I mean, this chapter, it really covers everything,
It does.
from how the program is financed to the different types of support it offers, retirement, disability, survivor benefits. It even gets into Medicare.
Yeah,
And then, all the way to who qualifies for what and how benefits are taxed. It's a lot,
that's a lot.
but we're going to unpack.
We're going to unpack it all right here. And it's important to remember why Social Security exists at all. This wasn't just some idea somebody had like on a whim. This was born out of the Great Depression and the huge like economic insecurity that was going on at the time. So many people were out of work and there just wasn't, any real support system for people if they got too old to work or if they had a disability. So Social Security was meant to be that basic safety net, like a foundation, but, not your whole retirement plan.
Right.
Okay, so let's get into it. Like, how does the money flow? How does Social Security actually get funded?
Well, the primary source of funding is through what's called the Federal Insurance Contributions Act, or FICA payroll taxes.
Oh, yeah, FICA. Yeah.
Yeah. So if you take a look at your pay stub, I'm sure you see these deductions.
Oh, yeah.
And right now, both employers and employees are contributing 7.65% each
Okay,
of an employee's earnings.
gotcha.
And that goes towards both Social Security and Medicare.
Okay.
And now if you're self-employed, well, you are responsible for the full 15.3%.
Yeah, 15.3%, that's a big chunk,
It is. It is.
especially if you're self-employed. And I remember from the chapter that not all of our income is subject to this, right?
That's right. That's right. So there's a concept called the taxable wage base. And what that is it's the maximum amount of earnings
Okay.
in a given year that's subject to Social Security tax. And this isn't a fixed number. It actually adjusts every year based on the national average wage index.
I see.
So it's constantly changing. So for both the employee and the employer, that 7.65% that we talked about, that really only applies up to a certain income level. But one important thing to remember is when it comes to Medicare Part A taxes, there's no limit. All of your earnings are subject to that.
Oh, interesting. So there's a ceiling for Social Security, but the Medicare part just keeps going. Huh. Interesting. Now, the chapter really went into depth about being insured when it comes to Social Security. So can you break down what insured status really means?
Yeah, I mean, that is a key concept to understanding who's eligible for what, right?
Okay.
So whether or not you're eligible to receive any benefits, it really hinges on whether you have achieved this insured status, which is all based on your work history and the contributions that you've made. And there are two main types of insured status: fully insured and currently insured. And to really access the full range of benefits, you've got to be fully insured.
Okay, so let's talk about those two. What's the difference between them?
Yeah, so to become fully insured, you've got to have 40 quarters of coverage
Okay.
throughout your entire working life.
Okay.
And, well, because you can earn a maximum of 4 of those per year, it usually takes about 10 years of work
Gotcha.
where you've paid FICA taxes. And when you're fully insured, that's when you really unlock the full range of benefits. Retirement benefits for yourself, surviving benefits for your family if something were to happen to you, disability benefits if you become unable to work, and Medicare.
Okay. And what about currently insured? What does that get you?
Yeah, so that's a little more limited. Currently insured, you need at least 6 quarters of coverage. But it has to be during the 13-quarter period right before your death or the onset of a disability.
Okay.
So it's a much shorter time period.
Yeah.
And it's primarily for survivor benefits only. So you wouldn't qualify for your own disability or retirement benefits with this status.
I gotcha.
And there's also a special rule for younger workers under 24. They just need 6 credits over the past 3 years before their death to be considered currently insured.
Okay, so if you want the whole enchilada, the full package of benefits for you and your family down the road, you've really got to aim for those 40 quarters, those 10 years of work to be fully insured. That's the magic number.
It is. And the chapter even kind of flagged this as an exam tip. 40 quarters, that's what you need to know
That's the number.
for maximum benefit eligibility across the board.
All right, so we've talked about the money coming in. We've talked about who qualifies. Now let's get into the actual benefits you can get, starting with survivor benefits. This is a part of Social Security that I think many people don't really think about until, they need it.
Right. And they're so important. Survivor benefits are designed to support the families of workers who have died.
Right.
Assuming the worker was either fully or currently insured when they passed away. There's a one-time lump sum death benefit payment of $255. But I do want to mention that this amount, it has not changed for like over 60 years.
Wow.
So think about that. That's, the average cost of a funeral these days is way more than that.
Right, more.
And so this benefit, it's just a drop in the bucket when it comes to covering expenses these days.
Yeah, that really puts it in perspective. Wow. Okay, so besides that initial payment, what other kinds of financial support are there for survivors?
Yeah, so beyond that initial payment, there are potential ongoing monthly income benefits
Okay.
for surviving family members. So for instance, let's say you have a surviving spouse of a fully insured worker who didn't have any dependent children. That spouse can start receiving benefits as early as age 60. But, the amount might be reduced if they claim it before reaching their full retirement age. And then if the worker was only currently insured when they died, well, then the scope of the survivor benefits that are available are much more limited.
Okay. And who else besides the surviving spouse might be eligible for these monthly payments?
Well, there are a few categories. So, a spouse of any age who is caring for the deceased worker's children, as long as those children are under 16, or if they were disabled before turning 22.
Okay.
Unmarried children under 18, or 19 if they're still in high school, they're eligible. And children of any age who are disabled before 22 and who continue to be disabled, they can also get these benefits. And then, sometimes dependent parents, age 62 or older, of a fully insured worker, if that deceased child was providing at least half of their financial support.
Okay, wow. So it's designed to catch like a pretty wide range of potential dependents. That's good. So what about how much they would actually get, the dollar amounts?
Yeah, so for children of a deceased worker under 18 or 19 if still in school, the benefit is typically 75% of the deceased worker's PIA.
PIA. Okay.
That's their primary insurance amount.
Gotcha.
For dependent parents, each eligible parent can get 75% of the PIA as well. But if there's only one eligible parent, then it goes up slightly to 82.5% of the worker's PIA.
Oh, interesting. I see. Now, I remember there was a term in the chapter that caught my eye, the blackout period.
Huh?
What is that all about?
Yeah, so that's a period of time after a worker dies when survivor benefits for the surviving spouse, they actually stop.
Oh, I see.
And this blackout period, it begins when the youngest child of the deceased worker turns 16, or immediately if there are no children receiving benefits. It ends when the surviving spouse reaches age 60. At that point, they can start receiving benefits again based on their deceased spouse's record.
Okay.
But importantly, the kids, they do continue to receive their benefit
Okay.
during this blackout period until they turn 18 or 19 if they're still in high school.
I see. So it's this gap that happens for the spouse, when the children are too old to qualify the spouse for benefits anymore.
Yeah.
But the surviving spouse themselves is not yet old enough to start getting benefits again.
Yeah.
Okay. The chapter also talked about a maximum family benefit. What's that about?
Yeah, so that just basically makes sure that the total amount of benefits that are paid to all the family members doesn't go over a certain limit,
I see.
which is based on the deceased worker's earnings.
Oh,
So, without this cap, in families with multiple survivors, theoretically, the benefits could just get so high that it might even be more than the worker ever earned themselves. So this maximum family benefit ensures that doesn't happen. And sometimes, that means individual survivor benefits get reduced a little bit just to make sure they stay within that limit.
Okay, that makes sense. So it's a good overview of survivor benefits.
Yeah.
Let's switch gears now and talk about disability benefits. What are the main requirements that somebody needs to meet to qualify for those?
Okay, so disability benefits are available to workers who are fully insured
Okay.
and who meet a really, really strict definition of disability.
Okay.
And Social Security, they define disability as the inability to do any job
Okay.
that would earn a substantial income.
Gotcha.
And this has to be due to a medically determinable physical or mental impairment that has lasted or is expected to last for at least 12 months in a row
Okay.
or result in death. So it's a really high bar to clear. It's not just about not being able to do your old job. It means you can't do any job.
Right. Any occupation. Wow.
Right. So, Social Security doesn't pay benefits for a partial disability or a short-term disability. It's got to be total, and it's got to be expected to last a long time.
Wow.
And another thing is there's a 5-month waiting period after the disability starts before the benefits can actually begin.
Yeah.
So that's something people should definitely keep in mind.
Yeah, a 5-month gap, that's huge.
Yeah.
You really need to have some other kind of safety net. So are the disability benefits calculated in a similar way to the survivor benefits?
They are. So it's also based on the disabled workers' PIA,
Okay,
their primary insurance amount.
gotcha.
And if the claim is approved, they start getting monthly payments, and sometimes their eligible spouse and children can also get benefits too.
Okay.
One other thing to keep in mind is that generally disability benefits are not available after you turn 65.
Yeah.
At that point, you're generally transitioned to retirement benefits.
Okay, that makes sense.
Yeah.
So now let's talk about retirement benefits, probably the most well-known part of Social Security. What are the basics there?
Yeah, so retirement benefits, they offer a monthly income to workers who are fully insured and are 65 or older,
Okay.
and also to their eligible spouses and dependents. So if a retiree waits until their full retirement age, they'll get 100% of their PIA. But, they can start getting benefits as early as 62.
Okay.
But if they do that, their monthly payments will be permanently reduced.
Gotcha. And full retirement age, that's not the same for everyone?
Right.
Right.
That's right. It used to be just 65, but it's been gradually increasing. So for anybody born before 1938, it's still 65.
Okay.
But for those born between 43 and 54, it's 66. And if you were born in 1960 or later, the full retirement age is 67.
Okay, so a lot of people today have to wait till 67 to get their full benefit.
Exactly.
Okay. That's an important thing to know as you're planning for the future. Now, what about if you're working but also receiving retirement benefits? Is there a limit on how much you can earn?
Yeah, so there are these limits, what they call earnings limits, if you start taking retirement benefits before you reach your full retirement age.
Okay.
So if you're under your full retirement age for the entire year, your Social Security benefits, they'll be reduced by $1 for every $2 that you earn above a certain limit.
I see.
But it's a little different in the year you actually reach your full retirement age. In that year, the reduction is only $1 for every $3 that you earn above a different higher limit, and they only count your earnings up to the month before you reach your full retirement age. But the good news is, once you hit your full retirement age, you can earn as much as you want without affecting your Social Security benefits.
Okay, so there's a real incentive there to wait till your full retirement age.
Yeah, definitely.
No more restrictions. All right, the chapter also mentions something called dual benefit liability. What is that?
Yeah, so that's when somebody might qualify for more than one type of benefit.
Okay.
Like a pretty common example would be a surviving spouse who's eligible for both their own retirement benefit based on their work, but they're also eligible for survivor benefits based on their deceased spouse's work.
Okay.
So they don't get to collect both in full. They
Okay.
get whichever one is higher. So the system's designed to give you the best benefit possible, but you don't get to double dip.
Okay, that makes sense. All right, let's talk about Medicare now. People often think about Social Security and Medicare together. How do these two programs relate?
Right. So Medicare is the federal health insurance program.
Right.
And it was established in 1965, and it's run by what's called CMS, the Centers for Medicare and Medicaid Services.
Okay.
And it's actually a key part of the overall Social Security system, or really what's called OASDHI.
Right.
And like we said earlier, it's funded in part through those FICA payroll taxes.
Gotcha.
So Medicare mostly provides, hospital and medical insurance coverage to people who are 65 or older.
Okay, so do you automatically get enrolled in Medicare when you become eligible for Social Security?
For the most part, yes.
Okay.
So most people who are eligible for Social Security retirement benefits, they'll also automatically be eligible for both Medicare Part A, which is hospital insurance, and Part B, which is medical insurance once they turn 65.
Okay.
And even if you're 65 or older and maybe you didn't work enough to qualify for your own Social Security retirement, you can still apply for Medicare,
Okay.
but you might have to pay a premium for Part A.
I see. And for people 65 and older, what do you need to be eligible for Medicare?
All right, so to qualify when you're 65 or older, you generally have to be a U.S. citizen or a legal permanent resident for at least 5 years.
Okay.
And either you or your spouse needs to have worked enough to be eligible for Social Security or railroad retirement benefits. So basically, you need those 40 work credits, which, is about 10 years of work.
Right.
Or you can also qualify if you paid Medicare taxes for at least 10 years, or if you're the spouse of someone who did.
Okay, so what about if you're under 65, can you ever get Medicare?
Yeah, so there are situations where people under 65 can get Medicare.
Yeah.
So anyone who's been getting Social Security disability insurance benefits or SSDI or Railroad Retirement Board disability benefits or RRB for at least 24 months after that 5-month waiting period we talked about for disability benefits. They become eligible for Medicare before 65.
Okay.
But there's a couple exceptions to this 24-month rule.
Okay.
So for people with ALS, Lou Gehrig's disease, they become eligible right away when they qualify for SSDI.
Okay.
And also people with end-stage renal disease, or ESRD, can get Medicare coverage after they get a kidney transplant or start regular dialysis, which is usually after 3 months.
Huh.
And, you also have to consider coordination of benefits here, because if you're under 65 and you're eligible because of ESRD, but you also have group health insurance, say through your job or your spouse's job,
Right.
then the employer's plan, that's usually the primary payer for the first 30 months of dialysis or a transplant. And Medicare is secondary.
Okay, so that's a little nuance to be aware of in that specific situation.
Yeah.
Now, what about original Medicare? Can you briefly explain what that includes?
Yeah, so original Medicare has 2 main parts, Part A and Part B. And Part A is what's called a hospital insurance. And that helps to cover things like inpatient care in a hospital, stays in a skilled nursing facility, some home health care services, and hospice care. And it's good to know that there are deductibles and co-payments and limits on benefit periods for Part A. And a new benefit period starts each time you have a new spell of illness. The good news is most people don't have to pay a monthly premium for Part A because they've earned that fully insured status through their work history.
Right.
But if you don't meet the requirements, you might have to pay a monthly premium.
Okay.
Then there's Part B, which is supplemental medical insurance. And that helps cover like outpatient stuff, so things like doctor services, outpatient care, medical supplies, durable medical equipment, and preventative services like those annual wellness visits and certain screenings and vaccinations. And unlike Part A, everybody who's enrolled in Part B pays a monthly premium. And usually that gets taken out of their Social Security check automatically.
Okay, so Part A is for when you're really sick, and Part B is more for regular doctor visits and checkups. Okay, last question. Are Social Security benefits taxable income?
So that's a little tricky. It depends. Social Security benefits might be taxed at the federal level,
Okay.
and it depends on how much other income you have. So for people who file a single tax return, some of their Social Security benefits will be taxed if their adjusted gross income, or AGI, plus half of their Social Security benefits is more than $25,000.
Okay.
And for those who file jointly, it's if their AGI plus half of their Social Security is more than $32,000. But, and this is really important, no matter how much money you make, 15% of your Social Security benefits is always tax-free.
Oh, okay, so it's not all or nothing.
Yeah.
Some might be taxed, some might not be, but you always get at least 15% tax-free. Well, wow, we covered a lot today. We talked about how Social Security gets funded, all the different benefits you can get, and even how those benefits are taxed. It's a complex system.
It is, but the main takeaway is that it's really designed as a social insurance program
Yep.
to try to give everyone some basic level of economic security when it comes to retirement, disability, supporting your family if you pass away, and getting health care through Medicare. And remember, it's all funded through those payroll taxes, and whether you qualify for most of these benefits really depends on how long you worked and whether you reach that insured status.
Exactly. We really dove deep today, but hopefully this gave you a better understanding of how this whole system works. So as you think about your own future, here's something to consider. With all these rules about who qualifies and all the different types of benefits and the taxes, what are the most important things for you to keep in mind as you plan for your future? What are the 1 or 2 things about Social Security that you really want to pay attention to? It's definitely worth thinking about. Thanks for exploring all this with us today, and we'll see you next time.